Infection control in a veterinary hospital. What is infection control? According to the World Health Organization, infection prevention and control measures aim to ensure the protection of those who might be vulnerable to acquiring an infection, both in the general community and while receiving care due to health problems. This can be in a variety of settings. The basic principle of infection control is hygiene. Why is infection control important? Well, first and foremost, in a veterinary setting, infection control is a crucial step we can take to help protect our patients. Practicing proper infection control can help reduce or prevent transmission of potentially dangerous pathogens between animals. It also helps control dissemination of pathogens to the surrounding environment. Some microorganisms can live for long periods of time on environmental surfaces. Good hospital infection control also helps prevent transmission of pathogens from animals to people and vice versa. Most well-established and emerging infectious diseases are zoonotic, so infection control protocols not only help protect veterinary patients, but they also help protect people. Let's recall the basics about how infectious diseases are spread. There are some necessary components involved in the process of disease transmission. All components must be present for an infectious agent to spread between animals, between people, or between animals and people. This process is commonly referred to as the chain of infection. First, there must be an infectious agent and some type of reservoir for it. The agent could be bacteria, viruses, or fungi, and the reservoir is the habitat in which that agent is able to live, grow, and multiply. Reservoirs could be humans, animals, or the environment. Next, a portal of exit is required. This is simply the mechanism by which the agent leaves the initial host. For example, a cough or a sneeze for a respiratory pathogen like Bordetella or canine influenza virus, feces or vomitus for canine parvovirus, blood-sucking mosquito vectors in the case of West Nile virus, or urine for leptospirosis. Transmission then must take place. Modes of transmission include airborne and droplet, fecal-oral, vector-borne, and contact, both directly, such as in skin-to-skin contact, or indirectly, such as skin contact with a contaminated intermediate object, like a stethoscope, a computer keyboard, or an exam table. And finally, the portal of entry is the way by which the agent enters the susceptible host. The portal must allow the pathogen to gain access to the specific tissues in which it can multiply or release toxins. For example, inhalation allows canine influenza virus to access the respiratory tissues, while ingestion allows canine parvovirus to access the gastrointestinal tract. What infection control measures can you take in your hospital to interrupt the chain of infection? Well, as the World Health Organization describes in their definition, hygiene is the basic principle of infection control. In a veterinary hospital setting, two critical hygiene strategies are hand hygiene and environmental hygiene. Hands are the number one vehicle for transmission of hospital-associated infections, so carrying out hand hygiene at the right time in the right way is the most important action you can take to break the chain of transmission. Shown here are 5 key moments in which hand hygiene should be consistently carried out. These moments include before touching a patient. This means immediately prior to placing your hands on a patient, being careful not to handle other animals, shake hands, or touch potentially contaminated surfaces such as computer keyboards or doorknobs. Think about when you visit the doctor's office. Do you appreciate seeing the doctor or nurse clean their hands upon entering the exam room before touching you? Washing or sanitizing your hands in the presence of the client before handling their animal demonstrates that the healthcare provider cares about protecting their pet's health. Before a clean or an aseptic procedure, such as inserting a catheter, even if you have cleaned your hands somewhat recently, it is always important to re-clean them just prior to this type of procedure. Gloves may also be worn, but remember, gloves are not a substitute for hand hygiene, and hands should be clean before donning and especially after removing gloves. After exposure to blood or other body fluids, such as urine, vomit, mucus, or wound exudates. After touching a patient. Even if an animal is apparently healthy, they may be colonized with or transiently carrying germs that could be harmful to another sick or injured animal. And lastly, after touching the patient's surroundings, even if you have not handled the patient itself, surfaces such as furniture, exam tables, or personal items such as leashes could be contaminated. It is also important to note that alcohol-based hand rub is recommended for routine hand hygiene, while hand washing is recommended when hands are visibly soiled. Whether hand washing or alcohol-based hand rub is used, it is important to cover all surfaces of the hands with soap or sanitizer, including rubbing hands palm to palm, rubbing palms over the dorsal surfaces of each hand, between fingers, backs of fingers with fingers interlocked, thumbs, and fingertips. Then towel dry after washing or allow to air dry after sanitizing. The entire hand washing process from start to finish should take between 40 and 60 seconds, while use of alcohol hand rub should take between 20 and 30 seconds. Next, let's talk about environmental hygiene. We will focus specifically on routine cleaning and disinfection. It is important to get to know your disinfectant. Shown here are several common chemistries used for hospital disinfection, and as you can see, new products have been developed over time. There are pros and cons to these different products as shown in this image provided by the American Animal Hospital Association. Some common products used in veterinary hospitals are chlorhexidine, bleach, and quaternary ammonium. A 0.05 to 0.5% chlorhexidine solution is effective against most bacteria, but is ineffective against most viruses. It is ineffective against non-envelope viruses or bacterial spores like canine parvovirus or Clostridium species, respectively. Bleach has a broad spectrum of activity against most veterinary pathogens, but can be irritating to the skin and mucous membranes, or corrosive to metal surfaces like animal cages. It can also become inactivated in the presence of residual soils or organic materials. Quaternary ammoniums have a broad spectrum of activity against many pathogens, but they do not kill certain bacteria, such as Pseudomonas, and like chlorhexidine, are not always effective against canine parvovirus or bacterial spores. A more recently developed type of disinfectant is called accelerated hydrogen peroxide. It is fast-acting, has a very broad spectrum of activity, and kills many organisms that other disinfectants might miss, including Pseudomonas, canine parvovirus, and bacterial spores. It is safe, sustainable, and can also act as a detergent, so it can be utilized for both cleaning and disinfection. Which leads us to an important point. Regardless of the type of disinfectant you use, it is important to always clean surfaces and allow them to dry thoroughly prior to disinfection. Cleaning and disinfection is a two-step process. As was mentioned in the previous slide, Some disinfectants are inactivated in the presence of soils or if mixed with cleaning detergents. Lastly, contact time is crucial for disinfectants to work appropriately. Contact time is the amount of time the surface is required to stay wet for the product to effectively kill most organisms. Contact times vary between products and even between different dilutions of the same product. Follow the manufacturer's instructions, which are located on the product label. Sometimes it can be helpful to color code disinfectants with brightly colored stickers, or write the contact time on the bottle in big letters so anyone using it can easily see. It can be helpful to create a hospital-specific cleaning and disinfection checklist like the one shown here. It makes sense to clean and disinfect certain surfaces found in veterinary clinics on a daily basis, such as doorknobs, cabinet and drawer handles, and buttons on phones or fax machines. Other surfaces that come into close contact with different animals, however, require more frequent cleaning and disinfection. Surfaces such as stethoscopes, exam tables, muzzles, and scales should be cleaned and disinfected after every use. Thank you for taking the time to review these basic principles of hospital infection control. Being diligent and consistent with your hand hygiene and environmental hygiene practices are two simple yet very important ways you can prevent transmission of potentially dangerous pathogens to your patients, yourself, or even your own pets or loved ones. If you have questions pertaining to infection control in your hospital, please feel free to contact the Infection Control Department at Washington State University Veterinary Teaching Hospital.